Welcome to In-Service Monthly's Dementia Care Series for nurse aides. This is Part 1, Mental Decline and Caregiving Challenges. Just about any experienced nurse aide will tell you, caring for residents with dementia has its own special challenges, but it can also be rewarding. There are moments when residents may be combative or say and do things that are hurtful to you and others. But they can also be affectionate and playful, and they are often grateful for the help you give them, or the time you take to talk with them. This nurse aide has focused her career on working with dementia residents. She knows firsthand the challenges and the rewards.
So Florence, you want to walk today? You want to get out the chair and walk?
Yeah.
Okay, Kay, you're going to brush your teeth now, okay?
Yeah.
All right. Oh, they're dancing. What about you? We could dance. Ooh, you are. Oh, see, you're better than I am.
Look at.
I'm pleased with what I do, and especially when you do something to them and you see that smile. You know, it makes you feel good to know that you are doing something good.
Dementia is a disorder of the brain that results in severe memory loss and a decline in thinking abilities. The leading cause is Alzheimer's disease, followed by strokes. Experienced nurse aides know that individuals suffering from dementia are victims of a condition beyond their control, a condition that can rob them of their identity and make them increasingly dependent on others for their care.
It's hard to see them like this. And so you try to give all you can to try to help them.
I always have a smile, and I always talk to them gently.
But you have to have patience and understand that this is a sickness that they have.
The purpose of this program is to examine how dementia affects behavior and the challenges it poses for caregivers. In Part 1, we'll discuss mental decline and caregiving challenges. In Part 2, we'll review some of the more common types of difficult behavior. In Part 3, we will have some final notes on dementia, lawsuits, and job loss. It is our hope that by understanding the nature of mental decline, it will be easier to prevent negative situations with residents. Harmful words or actions towards a resident cannot be justified simply because they happened in a moment of anger or frustration. These types of incidents can lead to charges of abuse or neglect. Experienced nurse aides will tell you that individuals who suffer from dementia require a special kind of care and a lot of understanding.
Always be alert, be calm, be gentle, understanding.
And sometimes they'll yell at you and slap you on the hand, whatever it might be.
I was hit with a towel, I was smacked on my butt.
Well, best thing to do is just ignore it.
The number one thing is don't take it personally.
It's the sense of humor does help.
At the end of this program, you should be able to describe how a decline in mental functioning can contribute to difficult behavior. Give 4 examples of changes in mental functions brought on by dementia. Give 4 examples of difficult behaviors. Give a general definition of dementia and list 3 causes. Describe actions you can take when a resident becomes agitated and resists care. And list 4 triggers that can make a dementia resident agitated. Throughout the program, nurse aides from around the country will share their insights and experiences. They are your peers, and they face many of the caregiving challenges that you do, regardless of what region they come from or their own personal background. There is a common bond among you, caring for those who are least able to care for themselves, and that is a very special profession. How dementia changes mental functioning. Imagine looking at yourself in the mirror and struggling to recognize the image of your own face. Imagine being unable to recognize family members. And imagine suddenly becoming lost, not knowing where you are or where you were going. These are only a few of the disturbing experiences of dementia residents. For their family members, it can be heartbreaking.
It's devastating when you have to, put them someplace. Because everything that you have known, the sharing, the caring, going places, doing things, it's gone. And all of a sudden, you have gone from being a married person with a spouse to being alone with no one.
The hardest part for me, having my mother here, is the fact that someone else is taking care of her. And knowing that someone else is taking care of her, I want her taken very good care of, you know. I want somebody to understand, to be patient, and just be a caring person.
As we noted earlier, dementia is a brain disorder resulting in memory loss and a decline in thinking abilities. It's a condition that's known to grow worse with time. An estimated 50% of nursing home residents suffer from dementia. The most common cause is Alzheimer's disease, followed by strokes. Other less common causes of dementia include brain tumors, Parkinson's disease, and alcoholism. In the case of Alzheimer's, the pattern is predictable. As the disease progresses, mental and physical functioning declines in stages. Individuals often become confused, fearful, and withdrawn. Communication becomes more difficult. Memory loss grows worse. As can be expected, their ability to care for themselves also declines. The final stage of Alzheimer's is a vegetative state followed by death. Although our focus here is on mental decline and behavior, it is important to note briefly some of the more common physical changes that also occur as dementia progresses. They include loss of mobility, weight loss, and a decline in bowel and bladder control. These topics are covered in Part 2 of our Dementia Care series entitled Physical Decline and Caregiving Challenges. Now back to our program here. The following section describes 4 examples of changes in mental functioning that are typical of dementia. Increasing forgetfulness and memory loss, difficulty communicating, confusion, difficulty with emotional control. Keep in mind that these changes usually have a dramatic effect on personality and behavior. Number 1. Increasing forgetfulness and memory loss. This condition may result in a resident being unable to remember the names or faces of loved ones and caregivers. It may also result in difficulty remembering simple tasks, such as how to use a toothbrush or an eating utensil.
They forget. They don't remember what's going on.
They might not remember how to eat. They might start to eat and might pick up the fork, and they'll just hold it.
Or they'll go to the bathroom and forget what to do. It's tough.
I'm going to put your stockings on, put your shoes on, get you dressed. And you say it like a couple times, then they'll get what you're saying. It's like if you say it one time, they don't hear you. You say it 2 times, they don't hear. You have to say it a few times.
Number 2. Difficulty communicating. For residents with dementia, memory loss and a decline in thinking ability can make simple conversations with others very frustrating. Sometimes they can't find the words to express what they're thinking or feeling. They may also have difficulty understanding what a caregiver is saying.
They get frustrated easily. They can't tell you what they'd like to tell you. The words just don't come out the way they'd like to say them.
How you talk is very important. And you have to be calm and gentle.
Keep the questions short and simple, and yes or no questions are the most easier for them to answer.
Make sure that you are speaking directly to the person, loud enough but not too loud, slow enough so that they can understand what you're saying.
Speaking slowly and clearly is also very important.
You don't rush them.
Number 3. Confusion. Residents with dementia may become easily disoriented, not knowing where they are or what time of day it is. Confusion may also cause a resident to wander and attempt to leave the facility. Some residents may even confuse the past with the present, believing that they still have children to care for or a job to go to.
They get lost right within the house, so this is not my house, or I don't belong here, or who are these people, they don't remember. They will
leave because they've got to go home, they've got to go to work, or they got to go and see about the children. You know, they got to go cook. They always got something that they got to do that they can't do here.
They say things sometimes that really doesn't make any sense. They'll carry a whole conversation, and sometimes the conversation might not make any sense.
You have to just slow down a little bit and explain sometimes who you are, why you're here.
A gentle touch, a gentle approach.
Number 4, difficulty with emotional control. Dementia may cause some residents to become emotionally unstable. For example, an individual who was once even-tempered may become quick to anger. Some may lash out verbally or even physically.
I had one resident who I was going through the door one day and he grabbed me by the neck like he was trying to strangle me because I didn't let him out.
I was kicked, I was bit.
Scream, or they might swear.
They get angry, and sometimes you don't understand why they're so angry, and they can't tell you.
You never argue with them. If you argue with them, they get mad. They get more upset, you know? And you don't want them to get too upset. You want to try and calm them down.
It is important to remember just how difficult it must be for individuals with dementia to cope with the disturbing changes we have described. A kind word and a little conversation can make all the difference.
They expect you to be that friend. You know, a lot of times just to go in there and sit down with them and talk to them. There's a lot of things they may want to tell you about that happened in their past. You know, little bitty things. They expect you to be there 100% all the time.
Dementia and difficult behaviors. In our last section, we established 2 important points. First, dementia typically results in a decline of mental functioning. Second, this decline also has an impact on an individual's personality and behavior. An individual with dementia does not seem like the same person that he or she used to be. That's what makes this condition so heartbreaking for family members.
I am the parent now, instead of being the child. It's a hard thing.
When he threatened me that time, and I knew from the look on his face, he meant exactly what he said. And I knew then, and the doctors, when I told them about it, they told me, they said, the time has come. You cannot keep him at home anymore because in his right mind, he would never hurt you.
The changes in personality and behavior brought on by dementia are what can make a caregiver's job challenging. Some residents are more aggressive and are easily agitated. Others may tend to withdraw.
Are you tired?
No.
You don't want to play?
No.
Okay.
Examples of difficult behaviors include resisting care, lashing out verbally or physically, combativeness, attempting to exit the facility, being uncooperative, withdrawing and refusing to socialize and participate in activities, and in some cases, residents seem to become more and more detached from reality.
They are scared, and they are worried about dying, and they are worried about a lot of things, and they might lash out at you.
One of my patients likes to scratch. One of my patients likes to just hold on to you. So it's hard because you're trying to ease their suffering, ease their pain, but when they try to hurt you, you know, you have to pull back. You have to pull back and leave them be.
They don't know any better. And it's up to you to be a better person.
You got to understand, and you got to know how to love them and say, oh, it's going to be all right. I love you. Everything's going to work out just fine. You just got to know how to, when they lash out, give them love.
It is commonly known that difficult behavior can be triggered by any number of factors. Examples of these triggers include fatigue, bathing, frustration with not being able to perform certain self-care activities such as oral care or toileting, some medications, pain and discomfort, frustration with not being able to engage in the activities that he or she used to enjoy.
If the resident is agitated, I'll leave the room for them to calm down, and I'll let the nurse know. I report it to the nurse that the resident is agitated. Then I'll go back with a different approach.
Gentle touch or a pat it's really nice for the residents. It makes them feel warm and cared for, and just makes them feel comfortable.
And here's another tip that's worth mentioning. One nurse aide we spoke with said that when a dementia resident becomes combative with her, she reminds herself it's just the disease talking. Dementia, lawsuits, and job loss. Preventing negative situations that can lead to lawsuits should be a concern for all caregivers. Here are some common sense tips on how to do this. Have a good understanding of dementia as an illness and how it can affect a resident's ability to function and communicate. Perform your caregiving duties with gentleness and patience. Be respectful. Take time to get to know the resident. Know his or her likes and dislikes or what triggers difficult behavior. Be friendly with family members. Treat them with respect and politeness. A family member who trusts you and knows that you care about their loved one may be less likely to take action against a facility. Know what to do when a situation becomes difficult. When a resident lashes out at you verbally or physically, don't take it personally. If he or she resists care, try again later or get someone else to help. And finally, report and document changes in a resident's condition. This last point is especially noteworthy. Reporting and documenting a decline in a resident's mental condition provides a legal record that you were alert to the possibility that a resident was at risk. Perhaps he or she refused to eat. Perhaps the person was becoming combative. Or maybe there was a sudden change of mood, such as not wanting to get out of bed and withdrawing from activities. Documentation and reporting of these types of changes can be used to help monitor and evaluate a resident's condition. These actions are critical to the development of a resident's individualized care plan.
Documentation is important because you're reporting what you see and what you do, and also it protects you, your job, the facility, and the patients.
The sooner you report it, the quicker something can be done. Sometimes when things are overlooked or not reported in time, it could be something small that could be taken care of. But if it goes on for a while, then maybe you'll end up with a very serious problem, and just by reporting it, you could have prevented it.
Once again, it is important to remember that problems resulting from mental decline can place a resident at a greater risk for mistreatment by a caregiver who lacks patience and understanding. Mistreatment could also happen in ways that are hard to detect, anything from unkind remarks and disrespect to being handled roughly by the caregiver. When caregivers abuse or neglect residents, not only do they cause residents to suffer, but there can also be consequences for the caregivers themselves. Lawsuits and job loss might be the least of their problems. They could also face criminal charges.
If you know that abuse is going on and you don't report it, and it is found out and it comes back that you knew, you lose your job, because we're here to take care of the patients, the residents. We're not here to keep our best friend from getting in trouble.
If I suspected abuse or neglect, I would go straight to the supervisor to let them know what I had seen or what I suspected, and if that didn't do no good, I'd go higher up.
You are in this field to help the residents and take care of them. And remember, this is their home.
We're going to end this program on a positive note. It is no secret that dementia residents can at times be challenging to work with, but there are also great rewards. And that's what a lot of experienced nurse aides will tell you.
I have seen a lot of residents go, and with every one of them, I can remember a whole lot of good things about what we did, moments we shared. I can recall funny things, sad things.
Little funny comments that they make sometimes, you know, how they talk to each other, and how when we get to know them, it's like a part of our family.
I treat every person just as if they're my mom or my dad, my family, because, I mean, if you don't love what you do, You know, everybody's not cut out to be a certified nurse's aide.
It's just a good, good feeling.